So the Ebola virus disease and complications. We're going to talk starting with the definition. The Ebola is an infection and general fatal disease marked by fever and severe internal bleeding, spread through contact with infected body fluids by a filovirus whose natural host species is unknown. Now we have a small video.
Ebola is a highly contagious and often deadly virus. People suffering from the disease are only infectious once they develop symptoms. These symptoms appear between 2 and 21 days after infection, usually from 8 to 10 days. The virus targets the body's immune cells. These usually act as a first line of defense, catching and digesting infections. Normally, the immune system is able to boost its defenses to fight off an attack, but the Ebola virus manages to defeat and even destroy immune cells, often ultimately leading to death. Early Ebola symptoms include sudden fever, a general feeling of weakness, muscular pain, headaches, and a sore throat. The virus then attacks and damages cells protecting the blood vessels. This causes bleeding, dehydration, and abnormally low blood pressure. The liver is an organ where the virus can develop quickly, meaning patients often suffer from stomach pain, diarrhea, and vomiting. Some people also experience reddening of the eyes, rashes, hiccups, difficulties breathing and swallowing, internal and external bleeding to death.
So now the applications of medicine. Once a human is infected from bats, it could be transmitted to another human through secretions, blood, organs, or other bodily fluids. The first symptoms are the sudden onset of fever, fatigue, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash symptoms of impaired kidney and liver function, and in some cases both internal and external bleeding. So now, going to the pros and cons. The pros are that there are a few tests that can help us identify the Ebola, like antibody, like antibody capture, enzyme-linked immunosorbent assay, antigen capture test, serum neutralization test, electron microscopy, virus isolation by cell capture, and possible diagnosis can also be confirmed through a blood test. Now, the cons is that there is no cure for Ebola, nor are there any vaccines that prevent the disease. Many of those who recover from the disease do so through the strength of their own immune system. So now we have a small video too.
Hey guys, welcome back to Honor and Law. In this video, we're going to talk about what are the post-complication of what you call post-complication after what you call the Ebola virus disease. Ebola virus disease. So recently there has been an outbreak in what you call the different parts of the South Africa. Okay. So like Liberia, Guinea, okay, some parts of Nigeria, okay, and Sierra Leone, right? So we're going to talk about the whatever the complications of this Ebola virus disease. So remember, it has a high mortality rate of about 50 to 90% of the people. Okay, 50 to 90%. Remember, so it's a highly what you call high mortality rate. Okay, it has a high mortality rate. And this virus, the disease, we don't have no new vaccination. There's no new vaccinations available for this. That's why it has become a matter of concern. And what happens? The patient infected once with the Ebola virus, he will present within 2 days or 2-3 weeks. He will have the symptoms, signs and symptoms of what you call the Ebola virus disease. And usually, what happens? If the patient is going to survive all this, it's going to be what we call the recovery is really quick and complete. Remember, okay? But 50 to 90% is what you call it's a fatal. Okay, guys. So what are the long-term complications of this? The patient if he suffers from Ebola virus disease. One is, remember, they will have what you call the joint pains, okay, arthralgias, right? And even what you call hair loss, okay. What you call if you talk about the eyes are what you call the commonly involved causes what you call the iritis, the iridocyclitis, and even the patients will have kind of a light sensitivity, excessive tearing. Okay, that's it, right, guys? And even it affects what you call the testicles, and causes the inflammation of the testicles. Okay, and even it affects the skin, causing skin peeling. Right, guys? So very important points what we are talking about here. And the patient will have what you call, she can have amenorrhea. Remember, she can have amenorrhea, know what you call menstrual cycles, right? And if it affects the ear, they can have what you call a hearing loss. Then they will have what you call tinnitus. Okay, and it can affect the parotid gland, causing what you call parotitis, right, guys? So these are the important what you call the post complications of what what you call Ebola virus disease. Okay, and even it can cause the fatigue, the bulimia. Okay, fatigue, bulimia, etc. Okay, guys. So remember, these are the important complications you should know about this. But it's really very fatal, 50 to 90%. Right, guys. So thank you so much for watching.
So now, talking about the issue of life in Ecuador, even though we're in a tropical country with the weather that is prone to acquire this type of virus because of the heat, there hasn't been reported a single case of Ebola, which in the case that it will exist, it will come back for us because we already have, during the winter season, we have to deal with the dengue, which is very common and it becomes epidemic, so that's enough to do for us. And then as a conclusion, the majority of complications start soon after discharge and suggest that care for survivors should begin during hospitalization and immediately after discharge to detect and treat complications early with the aim of preventing long-term disability. Thank you.